Hello. My name is Dr. Albaridi. Are you ready for your PRP procedure?
Yes, sir.
Fantastic. We're going to give you a nice little booster towards your improved hair growth. So this is an aseptic procedure. We're using these sterile gloves. Just go ahead and open that up for me, please. Thank you very much. And open up the syringe. So PRP is a technique that we use very often as a part of the regenerative hair growth. Our desired effect is to provide some micro trauma by using these special needles to the scalp, and then reintroducing a very natural solution which is located in all of our bloodstreams. All of our red blood cells are suspended in a very clear-like solution, clear as in no other particles present in it. What is present inside this solution is portion of the blood which is separated from the harder components of the blood. And after we spun the blood, we've separated this solution that contains growth factors, serums, and things that are important towards all regenerative aspects of human body, including in this case PRP for the hair growth. So begin procedure by cleaning the scalp and drawing some anesthetic solution. We'll connect the syringe with an anesthetic solution to a port that has multi-injection sites. So this is a local anesthetic that will apply to the patient's desired area of treatment. We can use this similar type of procedure and these types of needles towards any region of the body. As you can see, the nurse is now cleaning the scalp. Patient came already with a clean hair. And now we begin. The process is very, very simple. We can demarcate the area that we want to grow, but we're doing this as a very first treatment. And are you ready?
Yes, sir.
This is going to just sting just a tiny little bit, and here we go. Little poke. Little poke. How are you doing so far?
Good, sir.
Poke. Poke. You'll thank us later. After this is actually a very good process, part of the process, where by producing the microtrauma and multiple needle injections, we're prepping the area for the procedure itself. Turn your head to your right for me, please. We're going to go right here. Poke, poke. And as you can see, there's a small amount of blood that is actually coming. This is actually normal. Turn your head to your left. I know this is a little bit intolerable, and that's it. So we injected about 10 cc of this solution. This is a local anesthetic or very low dilution and very quick to act. And then we essentially just wait for a moment or two for a patient to, I guess, experience a little bit of numbness. How are we doing? How does this feel when I touch you?
I still feel it.
How about right here?
Still slowly numbing.
Slowly numbing?
Yep.
Okay, then we'll wait. So communicating with the patient is very important during this stage. Even though this is a procedure with very minimal risk and very low quality of possible complications, we want to provide as reasonable of a comfort that we can for this very brief procedure. It actually takes much more time for us to prepare the patient, to draw the blood, spin it, than to actually perform the procedure. You will see that it is probably one of those quickest moments that a patient wants to experience. How does this feel?
Better. It's becoming numb.
Becoming numb? Okay, good. So I just use basically my finger to assess the areas, and as I mentioned earlier, the local anesthetic takes a very short amount of time for it to act. How does this feel?
Still kind of feeling, but it is numbing though.
Numbing, good.
Yeah.
Okay. This is probably the right time to proceed this, and here we go. 1, 2, 3. 1, 2, 3.
Still feel it. Good.
We have about total of 10 cc of this solution, and through the port we inject it. And we're about halfway done. Turn your head. And we're almost done. We repeat this procedure in intervals of 6 weeks. Turn your head to your left. To your left. And we're done. And then you want to nicely massage this. The instructions given to the patient are not to wash their hair for a period of about 3 days, so 72 hours, and then to wash their hair with a very mild, non-irritating shampoo. In addition to proper treatment, it lies the nutrition. Patients are asked not to smoke, not to take excessive amounts of alcohol, and to actually take vitamins. We provide a really good nutritional support to the hair, nails by eating well, by exercising, and then in the case of wanting to improve the hair loss, we definitely ask our patients to use a product that has been shown to have clinical significance in hair growth, and that is the Nutrafol. And that's basically the end of the procedure. Now the nurse will take over, and then you can just relax and let your hair rest. The bleeding has stopped. We just have to wait for it to kind of take effect. And that really concludes our physical procedure. We will then slowly sit the patient up and ask the patient to continue with these recommendations. They'll be given a written set of instructions, and then we'll bring him in for a follow-up procedure in about 6 weeks, and then interact with him throughout this time.